homelessness, it continues to be a top problem here in the state of Hawaii.
Today, we are talking with city leaders about some innovative ways they are tackling this problem. Spotlight Now starts now.
You're watching Spotlight Now with Ryan Kalei-Suji and Yunji Denise on Hawaii News Now. Have questions or comments for our guests? Join the conversation in our Facebook live stream. Spotlight Now, where Hawaii comes to talk.
Hello, and thanks for tuning in here on this Tuesday to Spotlight Now. We are going to be focusing our conversation in this first half specifically about homelessness here on the island of Oahu.
And we want to bring in two leaders in this area. Dr. Jim Ireland is the head of the city's Emergency Services Department, and Dr. Scott Miskovich here from Premier Medical Group, who has been doing some really creative work with the city. Thank you, gentlemen, for being here.
Thank you.
Thanks for having us.
Dr. Miskovich, I want to start with you. You are in private practice, but now you have taken on this partnership with the city to run the A'ala Respite Center. Tell us about the center, what's happening there. For folks who are not familiar, this is the new medical respite center that is right in that old First Hawaiian Bank building right across from A'ala Park.
Just to give a little preface, I was called by the mayor, I think, and Jim was directly working with him probably 4 months ago, and he basically said to me, I know you've been working on this for a long time in your career, and enough's enough. I want to take a different approach, and I really want you to see if you can help us with a different approach to homelessness, because he made a comment which I think is pretty blunt that most of the listeners will understand. We've been pouring a lot of money into homelessness, but we're not seeing the results. There have been changes, and there are new things that are beginning to happen. And they turned over the old First Hawaiian Bank building, which is cat-a-corner to A'ala Park. Everyone in the state knows that's kind of the hotbed of what goes wrong in our state. And we were given it, and the mayor wanted it now to get opened. It was like he wasn't kidding us. The hands were pounding on this table, and he hooked me up with Sam Moku. They quickly worked on getting us a contract to run what's called a respite. Now, respite is a medical facility that deals with very ill individuals. And I also told them I thought from my prior experience we should have this facility open to any homeless, so we also combined an urgent care. So we are now open we opened it in 3 weeks. It was a bank and it had teller stations, and it was really old and ripped apart. In 3 weeks, with a combination of all our work together, we had it open and we started accepting patients. We have 32 beds interior, and we have 30 kauhalis that are in the parking lot right now.
And Dr. Ireland, I'm wondering if you can share a little light about how this has evolved and just the response has evolved since your time in being involved in what is deemed as a crisis with homelessness, and how this specific facility is making a difference.
Thank you. So, CORE, Crisis Outreach Response Engagement, is a city program about 3 years old now, and it came out of the frustrations, I think, of dealing with and the inability to deal with homelessness in a satisfactory way, despite all these resources, hardworking nonprofits. And what CORE quickly found out is we had this group of homeless who were not sick enough for the hospital, but way too sick for existing shelters, and there was nowhere to put them. And the answer was often, we'll just leave them where they are, which is, clearly not acceptable. And so we developed this plan to get kauhalis open. We opened one at Liahi Hospital, which has a 20 beds, and North Shore Mental Health is running that. But we needed another one in town. We needed a bigger one, and one that could do kind of on-the-spot care, where the one at Liahi is more structured, where they kind of get stabilized at a hospital and then go there. We needed one where we could just go right off the streets. And, CORE can get people off the streets, but again, if the ERs don't take them because they're not that sick, we have to be able to go somewhere, and this really fit the bill. And I think Dr. Miskovich and his team was the secret sauce, so to speak, that we were missing. And we're really making strides. And, he can share a little more about the data, but we have 55 people there today, and these are 55 really, really sick patients. Something like 10% have cancer, 10% have advanced heart failure, 5 or 10% are on dialysis. So these are all people who have, again, very, very serious medical conditions and nothing that you could even take care of adequately on the streets.
Okay, so let me stick with you for just a second, Dr. Ireland. Let's say you get a call from through CORE. Someone says there's a really sick homeless person that needs some help. Do you then do you bypass the emergency room then and take them straight to this center?
We do both. So if they're really, really sick, I mean, that could be hospitalized, they usually go to one of the local emergency rooms. But then what we do is we tell them, hey, when the person's done being in the emergency room, or if they get admitted to the hospital, when they're done being at the hospital, give us a call and we'll take them to all respite. That's one case. The other scenario is we call up Dr. Miskovich's team and say, hey, this is what we have. Here we are. Can we come over right now? And most of the time they say, oh, yeah, sure. Every now and then we get there, they're a little sicker than the paramedics or EMTs thought, and then we go to the ER anyway. But I would say 80% of the time they stay.
At least 80-90% of the time they stay. They make good decisions, yes.
The other thing we're finding is when we did an analysis of the first 50 or so patients there, many of them were what we call hyper users of EMS and 911. One person had 27 calls to 911 and 27 ER visits in the 6 months before that person got to the all respite. So we're short-circuiting fire, police, and EMS calls in the community by just having them there stable. So this is really saving money, it's saving lives, and it's getting people off the streets. And what I tell people is, we've got the point in time count, we have the numbers, we know, but really what I think I want, and I think what a lot of people want, is you want to be able to drive down King Street and not see people laying on the sidewalk or encampments. We want to be able to go to parks and not see people floridly mentally ill with no treatment. And this respite, as well as some other creative things the city is doing, I think will really make a dent more than that in this crisis.
And Dr. Miskovich, I'm wondering if you can share a little bit about some of those statistics and what you've already seen in these first few months, and just some of the things that maybe surprised you, that maybe you weren't expecting, or some of the things that kind of stand out through just being open.
Wow, what a terrific question. And it's the thing, Ryan and Yunji, that really makes a difference for me. Bottom line is, one of the things I don't think the public acknowledges is we are multiple generations into homelessness. Our homeless are getting older, and they're getting older in the streets. Our average age right now is mid-60s of these individuals. Many of them have been homeless for 10, 15 plus years. So what happens with your health care during that time frame? So that was the first thing, that just the age of these individuals living with really serious chronic medical conditions that we would all assume would be treated. Now, let me also highlight, of the numbers we just talked about, everybody has mental illness on top of it. It's impossible to be homeless for any period of time to not have mental illness. We have just another myth I want to clear up. Only 4 of these individuals we've treated so far, and we've treated up to 80 because some we have brought in and placed and moved to other areas, have been in Hawaii less than 4 years. These are our family members. These are people from Hawaii. So that's something that is really critical for me. Then when I look at a major thing right now over the holidays, we all appreciate the holidays. How do you celebrate a holiday when you're homeless? We just had Thanksgiving decorations, and we did crafts, and people got gifts, and we already have, I think, a lot of Christmas decorations up, and we're going to have a huge Thanksgiving feast. And I mean, we all should know this, but appreciate this, but when you take these individuals that are from Hawaii and you treat them with respect and you give them a purpose, they are really just normal kapuna or normal people. And that's something that just gives me chills every time I sit and talk with them.
Let me go back to something that you said, which is that mental illness sort of pervades all of these cases. Can you give us a little bit more details in terms of what Dr. Ireland was saying about the kinds of care that you have to give in terms of the physical care, whether it's diabetes or cancer or kidneys? Like, what are the actual illnesses that you're treating, and then how do you fit in the mental health care piece?
Okay, so the illnesses are untreated chronic kidney disease. Many have what's called a creatinine over 2. We have 4 on dialysis currently, which is mind-blowing to think you're homeless and now you're going to a dialysis center. Undiagnosed cancers, advanced cancers, a lot of chronic heart failure, people with what's called an ejection fraction under 15. That means that they're either palliative care or almost on hospice. A lot of these people are going to be moving into palliative care and hospice. They're so far along. One of the things when I first opened this center, working closely with Jim and his team and the mayor's team, I don't know about you, but I know people of Hawaii always were tired of seeing the TV show the people discharged from the emergency room, wrapped in bandages, homeless, back to the streets. So immediately I met with all of the hospitals and said, no more, we're here. So one of the things, please, you should not see these people, and we've had a great working relationship with Queens and HPH in Castle, and they are promising and they have complied where we get post-discharge. So we have a lot of people coming with big new rods and major surgeries and major wounds and wound infections. So we're geared to take care of all of those serious infections and post-surgical. If you come down there, you're going to see, I know I just bought 3 more walkers, but there's 12 to 15 people that require walkers or wheelchairs, to give you an idea. So, I mean, those are some of the ideas of what we're doing. When it comes to the mental illness, we are loaded with mental illness medications. I was prepared for that in advance, had it loaded. A lot of these people, since they don't have health care, maybe at some point we're in and out of emergency rooms, we're given medication, but they stop taking them, or they don't refill them. So we've found all the people then also have a medical record. So we go onto their HHIE, which is the statewide system to show all their emergency visits. So now we've pulled it all together, which allows their care to be coordinated. We see what they were on. We restart medicines. We're using a lot of the Invega, which is the once a month shot for schizophrenia. And so you see schizoaffective disorder, schizophrenia, bipolar, substance use disorder through the ceiling. That's, the meth and alcohol and a combination of all of the above. And then another one that just goes too low that needs to be brought up more is PTSD. It's pretty impossible for you to be homeless and not have PTSD, because what do you do when you're homeless? Every night, any valuable you have, you put it under you and you sleep on it. And everybody's been assaulted and had everything they've stolen multiple times. So it's a tough way to live.
And Dr. Island, I'm wondering from you, in just the experience of working with CORE, how do you make that determining factor about who goes to this facility and who goes to other services that you provide? And how much has this impacted just the overall workload that EMS already has to do upon everything else that you folks are responding to?
Well, CORE tries to get folks off the streets or respond to calls, so EMS doesn't. So it indirectly helps EMS. The community health workers and the EMTs, we also have a nurse. They'll make a clinical decision on should this person, if they're kind of what I would say walkie-talkie, walks around, built their pallet fort on the side of the road, it's an able-bodied person, they might be a good candidate for HONU, which is the movable tent shelters. Wrap it in, wrap it out, try to get people housing quickly from HONU. That would be for that person. Maybe IHS might be a good fit for some people for shelter. But I think if the medical problems, when they're finding, again, especially wounds, untreated cancers, and heart problems, then it's either, okay, do we go to the ER or do we go to the respite? And if we do go to the ER, then do we go to the respite after? And so they're making those clinical decisions in the field. Sometimes they involve me or other members of the team that are sometimes I'll talk to Dr. Miskovich and his staff there. There's a physician down there to help decide who's the best fit for where. The other thing I'll just share with you that I found very interesting about this respite. And again, my career has not been in homelessness. I've been in this about 3 years now. I'm an internist by training, a nephrologist. If you need high blood pressure control, I'm your guy. But as far as homelessness, something I found very profound is we had 32 hospital beds donated by Wahiawa General in Queens in the bank, 32 beds. Pretty close, male, female separated, and then 30 Cal Holly outside, individual, everybody gets their own. By far, the first 30 or 40 residents wanted to be in the bank. They wanted to be next to other people. They wanted to be in that communal setting, because I think just being by themselves was just so foreign for them and so scary. They wanted that tight-knit community to get this emotional support. And if it was me staying there, I'd be out in the Kauhali and have my little barbecue and doing my thing in the corner. But that mentality is just something that if you haven't been homeless, you can't really wrap your head around. And that's the other thing, is we're really trying to recruit, in CORE anyway, people who've had these experiences, and they call it a shared experience, so they can really relate on a personal level to people who've been that. Do you see that too?
Oh, absolutely. The other one of the things I should have answered when you asked me what surprises me the most, just like Jim is saying, you go in there, they form little friendship groups. Man, I just sit there and I hang with them and, talk story as they're watching the greatest movies, because we have 2 big TV screens set up with a lot of seats, and we have computer stations, and you get to talk to these people and you can start to see that they're making friends, and it's all peaceful and there's nothing violent at any point. And so that's really wonderful to see. I will add that I'm riding with CORE periodically. Dr. Mike Chamberlain, who's coming as Josh's representative through the state, is riding, and we're going to be doing that a little bit more.
Josh being the governor.
Yeah, I'm sorry. Oh, that guy.
Dr. Green, right? That's put his doctor hat on for that.
Yeah. Sorry.
Dr. Miskovich, let me ask you this. How long are people expected to stay? This is not a permanent facility. This is not like a typical Kauhali where you can kind of stay indefinitely. The goal is really to move on, correct?
Correct. And now this is what the nonstop work has been that I'm doing in coordination with this big team with city and county and state, which, I know you're going to talk and highlight, but the coordination between city and county and state is fabulous. That's what's starting to make this work. But ideally, we would like them to stay normally no more than 3 months would be the key. Everybody's going to be different. As I said, we're at 55 right now. We've had up to 80, so there's already been, upwards of 20 some that have moved out for many different ways. But as I've also stated, we're going to have palliative care. We're going to have hospice care. We're going to have true skilled nursing home. Now, a larger group that we're going to have is, say your parents, they're at home and you talk to them all the time, but they get forgetful. They forget their doctor's appointment. You ask them about their meds and you see they're not taking their medicine, and you look and not a lot's in the refrigerator. You're going to talk to them about getting them into an arch, which is, a type of assisted living facility. That is what a lot of these people need, because they are really in this position because of their advanced multiple health conditions, mentally going downward, and that's what we're working on now. All of these different levels of placement.
I think it's fair to say that a majority of these folks will never go into normal housing.
Correct.
They're just too ill. So skilled nursing facilities, foster care, really is the output, I think, that we're trying to capitalize on, because we know we have to move people out to get new people in.
And that, fortunately for us, because, it's not a limitless bucket, in all the different funding sources where city and county and state go, and that is, a lot of that is a medical benefit. And fortunately, we are finding a lot of these people do have MedQuest or Medicare, so we're trying to get them appropriately into different facilities and homes that have the ability and are used to taking those other insurances. So that's part of the plan we're working on currently.
So based on what you've experienced and what you've noticed so far, maybe for you, Dr. Ireland, where else could you see this working? I mean, because I think a lot of things have to line up. You need the space, the facilities, the infrastructure, the support. Could this be replicated in other communities? And maybe where else could you see this being most beneficial?
Absolutely, to your question, this should be replicated in other communities, because one site isn't enough, and even with the Leahi respite. And when I visited other encampments and homeless populations around Oahu, people get really tied to neighborhoods. The West Oahu folks, a lot of them born and raised in West Oahu, they don't want to go to other places. Same with Windward and North Shore. So, very generally, probably one in West Oahu, one central Oahu to the North Shore, maybe one on the Windward side. So 3 more would have a good, I think, coverage of the island.
And tell me a little bit about the investment, Dr. Ireland. How much money is the city, and I know that this is really the purview of the mayor and the city council, not necessarily you directly, but what is the general investment in this, and why is this a good use of taxpayer money?
Well, this Kauhali et al., and not counting the purchase of the bank and that sort of thing, is about operationally $4 million a year to run. And roughly any Kauhali the same size would be about the same cost. So 60, 62 beds, 24/7 urgent care, all that medical care, about $4 million a year. But we're saving at least that or more in unnecessary ambulance, emergency room, and hospitalization costs that are generally paid by Medicaid or Medicare, which are government-funded insurances. I mean, I would say it would be hard to find someone who's homeless with a commercial health insurance like HMSA or Kaiser. I don't know if it's impossible, but it's very, very rare. So we are giving people an appropriate level of care that's not inexpensive, but it's certainly not as expensive as what has been happening previously.
Dr. Miskovic, I want to ask you something that you had mentioned earlier about the type of people that you are seeing coming into this facility. You said, those who have been here in Hawaii for more than 4 years. But I think there's often a conception or a notion in the community that people think that a lot of the homeless that we see are those who are being flown in here to the islands that have not been here for long. Are those the type of individuals that you're seeing in the facility?
No, and as I stated, only 4 have been here for less than 4 years. And I wanted to just highlight to the listeners and viewers that we have data. And when you do something like that, rumors, we have to put them aside and we have to look at data. We have the point-in-time count, which is federally mandated, it's guided. And this year, I think an important thing was there were like 119 or 130 extra people during the point-in-time count, which of course increases its accuracy. And essentially, during that point-in-time count, only approximately 8% or so were from the mainland, but you can break them down further in the questioning. A third of those were here for a job that didn't work out. Another third were here visiting family, and that didn't work out, and only 1/3 were just on a one-way ticket. So that's what the facts show.
Dr. Ireland, I want to get to a different demographic that you had mentioned, and that is just the age of the individuals that are coming to these facilities. We've talked to Connie Mitchell in the past, and she has said that one of the areas that she is most concerned about are the kupuna who are homeless, just because of the level of care that requires. If you have someone with dementia or the kind of chronic illnesses that you're talking about, that can require, one-on-one care. What do you see in terms of solutions around this particular issue and some creative ways that we can deal with it? Because we know that we have an aging population in general, and homeless are clearly not exempt.
Correct, yes. And, we are taught as a society to respect our elders. And my definition of elderly changes every year as I get a little older. But when we see people who are in their 70s and 80s fending for themselves on the streets, it's just completely unacceptable. And again, varying degrees of dementia through no fault of their own. These aren't people doing substance abuse. These are sometimes widows or widowers who have fallen on hard times and just never probably imagined themselves in this situation before. So not that any one group is more deserving of the other, except though I do believe that there's been such a push to get families and children off the streets and has been successful. So we don't see a lot of families and children. We still do, but not like maybe before. And I think the next big push, and the push right now, is for people who are older and elderly. One thing I wanted to just correct earlier is I said, our efforts with this Kauhale and CORE and the respite and all the things we're doing in the city, I think I misspoke when I said we want to put a dent in homelessness. We want to actually eliminate homelessness. And maybe that just sounds grandiose or a little out of reach, so to speak, but it really isn't. This is a scalable problem. We know what the point-in-time count is. We know if we get a certain number of people off the streets every day, that could translate into 1,000 or 2,000 a year, knowing, though, that more will become homeless and some come in from the mainland. But this is really something where we want to drive down the street and not see anybody. And so, now in kind of my warped brain, when I drive down the street, I'm like, okay, there's a CORE customer. Okay, we got to get CORE over here. And, hey, we need CORE over here. And different people in government and other people I know are texting me, hey, take care of this. And, hey, you need to look over here. And it's a lot, but I think we've made good strides in Chinatown over the last 2 years. I mean, the merchants there tell me homelessness is down there that they see visually 50 to 75%. And so I think we can achieve those results everywhere on the island. And this is just one piece of that overall strategy to succeed, and I think we will. We have a mayor that's also a former football coach who challenges us every day to do better. And he's he's angry. He wants these folks off the streets. He wants them helped. And it's also just a humanitarian approach to just making their lives better. And so again, with him kind of leading the charge, working very closely with the governor and his team, the nonprofits, Dr. Miskovich, I think we have everything aligned now that we will be successful.
I just do want to follow up on that comment about what you're seeing in some of these populated areas, because some of the things that we've also reported on here and hearing from members of the community is that we are now seeing homeless in parts of the island and communities that we would have never seen before as they make their way more inland towards, say, Diamond Head, Kahala, going into the Hawaii Kai area and other areas. How do you respond to, maybe those that are going into different communities, and how do you find support for them? Is it a matter of transporting them into some of these facilities, or how do you combat the perception that the homeless are moving?
Absolutely agree. All of the above, really. So CORE is mobile. We have a bus now, a retired city bus that's CORE on the side, and it brings the CORE team to those encampments to get people out of those areas. But having said that, we do recognize that Palolo, Hawaii Kai, parts of Waimanalo, parts of the North Shore do have encampments now that never had before. Some of those people are from those areas, not always, but we do need solutions, pretty much in every council district on the island, whether it's a kauhale or a respite or another shelter. Also affordable housing, that's a part of this too. So this just kind of multi-pronged approach to tackling this is really what's going to give us the best chance of success. But we also recognize people are going into these communities that hadn't been before. And then the other thing I'll just add is, once we take care of all the people that we can help that voluntarily want to go, there is an element of criminality hiding amongst the homeless. There are people who want to deal drugs, who are sex trafficking, who are doing just really bad things in the community. Once we get kind of the innocent bystanders separated out of that group and into these different places that we have, the criminals will be out there naked, and that's HPD. That's not going to be CORE. It's not going to be Dr. Miskovich. That's going to be a police matter. But I think once we take out 70 or 80% of the people who aren't committing hardcore crimes and leave this minority of folks there, it'll be much easier for the police, I think, to deal with that.
That's a really interesting point. Dr. Miskovich, one of the things that we know all agencies are facing in government is a lack of workers, and this kind of project is not possible without a private partner. Are you thinking that you want to replicate the work that you're doing here in some of the areas that Dr. Ireland was talking about when they talk about standing up other facilities? Would that be something that you would take on? Or, because we know that there usually has to be some kind of a nonprofit or for-profit partner, because the city can't do this all by themselves.
I stand to serve the mayor and his team and the governor, and they will tell me if they need the help. Now, I think a lot of people have seen me too much over the COVID period, and we were able to flex up with just under 600 workers that I brought on during COVID. And I think that's one of the things that the mayor turned to me. He knew I could bring the people together, and I think we're just really wired, and I have a large enough organization, I could bring the people in. But yes, that is an issue. And understand, too, when you're looking at our facility, a full-time physician assistants, nurse practitioners, there's always 2 or 3 RNs on site. It's a challenge.
And one thing I'll just add real quick, too, that we also partner with the Home Project at JABSOM, CORE does, and that's medical students with a physician faculty oversight to provide an opportunity for them to get medical experience with people in some of our shelters. And I think Dr. Miskovich has similar arrangements with some other schools. But we have young people coming into healthcare that are part of this team too. And that, I think, is teaching them a lot more than just medicine, empathy, relating to people, seeing how really unwell people who've had to live on the streets, in what kind of situation they're in, and really how we can help them.
As we are running out of time here, I do want to just kind of elaborate and extend on that point. What do you hope that the community knows about not only what you're doing at this facility, but just the overall plan of how people should approach homelessness moving forward, and maybe the misconceptions or anything that you feel that is out there that you would like the public to maybe challenge themselves on and how they view this issue? I'll start with you, Dr. Ireland.
Well, one of the things the city is also doing is what's called a command center. It's virtual, but it's keeping track of every shelter bed, every resource that we have, where people are. I think I'd like to see us better tied into maybe an app with geolocation, and so the reporting is maybe a little more seamless. We do have a core hotline, but I think I just want people to know that we're working very hard at the city with all our partners. We're not going to have success overnight, but we will have success. We are making progress, not as fast as I want or the mayor wants, but we are moving in the right direction, and I think we are going to succeed.
Yeah, and same question for you, Dr. Miskovich. What do you wish people understood about this?
Wow, this is huge. Now, prior to this get-together today, I sent you and Ryan a editorial that I wrote for the Civil Beat. It was back in 2017, and I want to speak directly to the people of Hawaii. The only way that's going to get better is if you make it better. Don't make this a government problem to fix homelessness. By the time we are dealing with these individuals, it's at the very end of the process, at the very expensive part of the process. I could sit, and I wrote in some of the pre-editorials that I wrote to 2017, I could pick the next 150 homeless out of my practice and know who is progressing that way. Well, guess what? The people of Hawaii can also. Who are homeless right now? There are people that are going through undiagnosed mental illness. They are happening, they're in the family, and people are seeing them act differently, but they're not getting adequate quick care. 50% of everyone in the state of Hawaii knows someone with substance use disorder, whether it's alcohol or meth or some other kind of drug, so you're watching it occur in your homes. New data from the Department of Health showed that 20% of couples have intimate partner violence, and that's another big factor in our state that leads to this. We're watching what's going on in Waianae as our youth, it's crawling back into our middle schools and high schools where there's increased violence, and that those violent tendencies are leading to shootings and stabbings. We have to start reaching there. Those kids are starting to do substances. So prevention and reaching the root cause of homelessness is the only chance we have as a state to really reducing, because right now what's happening, living it firsthand with the mayor and the governor, it's incredible, the coordination and the cooperation that's going on, and we see kahalis everywhere. There's so many efforts that are going on, and we're going to talk a lot more in the next month or two about some of the other really big things we're on right now. But the people of Hawaii need to do their part. They need also the doctors. We need to do our part in our offices. You need to screen these patients for this. So it's time for everybody to step up and help and realize we have a role.
Okay, that's a great call to action. Dr. Jim Ireland, Dr. Scott Miskovich, thank you both for being here today. We're going to continue our conversation. We're going to be talking about affordable housing. Join us right after this. Stay with us. You're watching Spotlight Now.
Welcome back to Spotlight. Now we're continuing on in our conversation here. We were talking, of course, earlier about homelessness and some of the efforts that the city and county of Honolulu are making and the progress that they're making. But now we want to turn our attention to something that's still related to homelessness, but maybe more on the preventative side.
Yeah, we're talking about affordability, and one of the groups that is working to make sure that we can stay and live and thrive here in Hawaii is the Holomua Collective. Joining us now is the executive director of that group. That's Joshua Wish. Josh, thanks for being here today.
Happy to be here. Thanks for having me.
You know, I think there are a lot of folks who are maybe familiar with your work, but not necessarily familiar with the collective itself. So tell us a little bit about this group, how it came to be, and the work that you're doing.
Absolutely. So Holomua Collective is a nonprofit local organization that is working to keep working families in Hawaii by making sure that they can afford to live, work, and play here for now and for future generations. We do that through a few different things. We provide public education about how government works so we can try to increase civic engagement. We try to provide better data on cost of living and the types of things that impact cost of living so we can ultimately create evidence-based policy solutions to try to move the needle on that. And one of the things that's a little bit different about us is the way we really approach all of that is by intentionally trying to break down silos and bring together people from the for-profit, nonprofit, government, and labor sectors in the room together to try to find common ground on some of those sustainable solutions.
With taking some of this information that you gather, I imagine a lot of it is policy driven, and you worked with lawmakers and legislators based on some of the information that you've gotten so far. I mean, what are some of the things that you feel like could happen in the upcoming legislative session that could maybe provide support in the areas that you just addressed?
Yeah, well, some of the things that we're really focused on right now, there are a few key cornerstone areas. Of course, housing affordability for local families is a big one. Creating a resilient local business community, because the local businesses are really the ones that power our economy, and making sure that they're able to thrive here. Speaking of thriving, making sure that we have a thriving government that can work for all working families and that it's doing the best it can do for everybody in Hawaii. And just broadly speaking, creating and sustaining a healthy economy.
These are all initiatives that I think a lot of us support. I want to get into the data, though, because I was so struck on your website. You have this affordability survey, and it really gives some numbers to what I think a lot of us are feeling about just being squeezed in Hawaii. What did you find?
Well, so we surveyed 1,500 local residents, and these are all people who exclusively work for local organizations. These are primarily middle to upper middle income folks in a median household size of 3. So if you think, for example, of 2 public school teachers and their children, that would be a pretty good example of the kind of people who were included in our survey. And these are folks who are overwhelmingly long-time to lifetime Hawaii residents who are deeply rooted in their communities, who report that they also really like their jobs. And even with all of that, these are folks who are really struggling to figure out whether that they can stay in Hawaii or not.
Okay, and tell us a little bit about the consequences that you are projecting out. So let's take those 2 public school teachers.
Yeah.
They feel squeezed. At some point they say, we can't make it. We can't live in Hawaii anymore. What are you seeing in terms of potentially, because we talk a lot about, on this program, wanting to keep Hawaii folks in Hawaii. That's Kama'aina and Kanaka together, right?
Yep.
We now know that we have more Native Hawaiians who are living outside of Hawaii than in Hawaii. But what are some of the consequences that you project out, taking that public school teacher example?
Yeah, no, it's a great question. There are some specific consequences that we found in the results of the survey. One of the questions that we asked, and this is one of the ones that I just can't get out of my head, is we asked, do you think you're going to need to move to a less expensive state? And 70% of the people in our survey said either yes or I'm unsure. And of those 70% who said yes or unsure, almost half said that they're going to have to leave within the next 5 years, which makes it pretty specific and even more dire. And when we dig into that a little bit deeper, and you take a look at who some of those folks might be, one of the things that's particularly alarming is that we're at risk of losing about 84% of our young workforce. So when we ask that same question, do you think you're going to need to move to a less expensive state? For folks who are ages 25 to 34, generally kind of that young professionals category, 35% said yes, just yes, I'm going to need to move to a less expensive state. And 49% said I'm unsure. And that's how you get to that 84% at risk of leaving. which is gigantic and tremendously alarming. A couple of the other things that are interesting is when you take a look at renters and homeowners. Same question. 20% of homeowners say, yes, I'm going to need to move to a less expensive state. And when you think about how so many of us have our assets invested in our homes, very often you think, oh, if you're a homeowner, you're probably fine. But 20% of them are saying, I'm going to have to leave. Almost 40% of renters said that they're going to have to move to a less expensive state. And then the other thing I'll note is it's even people who you would think, based on household income, are probably fine. So when you look at people who are making $100,000 to $150,000 a year, who I think many people among us would think, you're probably okay, that sounds like a lot. I think it was 25% of them said that they're going to have to move to a less expensive state. And let me just make a note into this to make sure I'm getting it right. 25% say they'll need to move, and another 45% are unsure.
Wow.
And so you're hitting it across the board. Young workers, renters, people in that $100,000 to $150,000 category. And I think one of the things that reflects too is it's all of us. It is certainly lower income folks, but also folks that you'd think might not be impacted by that. Anecdotally, personally, over the last couple of years, I've had multiple doctors end their appointments with me telling me, by the way, I'm going to have to refer you to another doc because my husband and I are moving to Vegas, to Salt Lake City, to Seattle.
Yeah, I mean, I have friends who are doctors that actually left the state as well, which only hurts us because of the condition that we are with our medical field and just the need for support there as well. So I want to ask you, with some of those alarming numbers and really those eye-opening numbers, what happens if this actually comes to fruition? If those who are saying yes or who are saying maybe end up actually leaving, what does that leave behind, and what are some of the impacts that creates in our own community?
Yeah, I mean, a number of things. One is, I think, Yunji, you already said it, which is we lose our local culture. And you mentioned, I think it was last year or the year before, was the tipping point where we now have more Native Hawaiians living outside of Hawaii than in. And if we don't have Native Hawaiians in Hawaii, what do we actually have? And even more broadly with the local culture, if we have more people living in Hawaii who weren't born and raised here than who were, what does that leave us? So there's that cultural aspect, which is huge. Then there's also the fact that we're going to be losing critical people in our workforce, everything from educators to healthcare professionals and more, which is going to make it really challenging to continue to have a vibrant culture, a vibrant Hawaii. And that was also something else in our survey, was something like 80% of the people agreed that's something we need to fix. And also a generational gap. This is something that our team was talking about, is when you take a look at that 84% of young workers at risk of leaving, where does that leave the kapuna when all of those folks leave? You've got a bunch of people who are going to be aging without their children and their grandchildren around.
You know, what struck me so much at the numbers that you just presented and looking more broadly at the survey on the website, and we really encourage folks to take a look at their website because this survey is so striking, holomua.org. But what struck me about it was
holomuacollective.org.
holomuacollective.org. You've got to get the website right. Yep. But what struck me is that so many of the conversations that we have are about, I want to make sure my kids can move back. I want to but this is not a later down the road, make sure the kids that go to college can come back. This is a problem that is happening now with people who might be starting to have even college-age children. I mean, this is something, so talk a little bit about that it seems like we've been focused, maybe, not that demographic is not important, but our demographic focus has not been broad enough.
Right. Yeah, and I think, one of the things that indicated to us how immediate this is, and this is beyond the numbers and into some of the personal stories. So if I can sidetrack it just a moment, the numbers themselves were striking, but one of the things that really impacted me was we also asked open-ended questions in the survey. Now, I don't know about you two, but when I answer a survey and there's a chance for open-ended questions, I'm not proud, but usually I skip that. Right? I don't have the time. I don't like typing on my phone. Hundreds of responses. We had hundreds of people answer those open-ended responses. And we were asking things like, what do you do to stretch your money to be able to stay in Hawaii? And we got answers such as, I grow my own food. I bike to my second and third jobs to save money on gas. I eat unhealthy food because it costs less than healthy food. And I can't afford to have children. And those kind of things, beyond the numbers, really, I think, show the immediacy of this. And having that many people respond with those kinds of things, I think it felt like a cry for help. We had multiple people, when we asked how they stretched the dollar, multiple people answered, starve.
Yeah, it's very striking when you hear sort of those responses. I'm sure at times will just kind of, at times may seem like a shock, but it is reality, and these are real people behind these responses. So with taking all of that, I mean, what are some of the practical things that can be done or that you folks are working on to try to change this? Because this is not obviously something that's going to happen with one piece of legislation or happen overnight. It's going to take some work. What would you say is the priority at this point to really help to stop some of these trends that are happening?
Yeah, absolutely. I mean, and like you said, if there was a silver bullet, we would have already used it, right? So, and the causes of things like out-migration are varied and complex. So, a few different things. We need to continue to find ways to reform our systems, reform government systems to make sure that they're working as well as possible for everybody in the state. We need to find ways, not just to necessarily make housing more affordable broadly, but to make it more affordable for local families specifically, and to make sure that they can stay. We need to find ways to support the local businesses, which are the ones that are employing the overwhelming majority of our local residents. And those are all the kind of things that make sure that you have a healthy economy. The other thing that we've found in the work we're doing and the way that we're doing it that does make a difference is by trying to break down those silos. And in your individual life, that could be actually just talking to your neighbors who you might not normally talk to or you think you might not have anything in common with. And in the kind of work that we're doing, it is trying to get for-profit leaders in the room with nonprofit leaders and elected and appointed government officials and labor leaders, folks who might come in thinking I've got nothing in common or everything you're trying to pass is something that I would spend my lifetime trying to oppose. And when we've been doing that, sometimes we have just straight up found common ground on solutions where people didn't think there would be any. And other times we've been, at a minimum, been able to find common ground on the values that bind all of us as Hawaii residents. And that's been a difference maker in a lot of the conversations we've had. And you need to do that over and over and over again to make it scale.
I think one of the things that you mentioned at the top, you said that one of your priorities is functioning government. And functioning government also requires participation. And there could be someone watching right now, probably more than one, who says, that survey, that's me. Like, I identify with that. For the person who is biking to 2 or 3 jobs, how do you encourage them to make sure that their voice is heard? We do have the legislature coming up. We know that lawmakers respond to public testimony. We know sometimes it's hard to participate. So how are you working to make sure that that voice is part of that conversation?
Yeah, so there are a number of things that we're doing. One of the things that we're doing is we've been holding an increasing amount of what we call demystifying government sessions. We've done these that are focused on state government. We've also done them specifically already for Hawaii County and for Kauai County, and we're working as we speak on doing one for the city and county of Honolulu. And what we do with these sessions is they're about almost a full day, and we bring in leaders from the executive branch, the legislative branch, and the judicial branches in each of those areas, and then we just invite the public to come. And we cap the attendance so we can try to keep it a little bit intimate and get people to really know these folks who are running the government. And we just kind of pull back the veil on here's how things actually work. And we've had people just tell us, I didn't know that was how it actually worked. And also, oh, I thought that person was just kind of a politician, but they're actually a normal human like me, which I think is also good to note too, which is that the folks who are in elected office, they do often get a bad rap, but these are folks overwhelmingly who could be doing almost anything else, probably very often for a lot more money, and who are working really hard to try to make a difference. And very often they get rewarded with a lot of flack from those of us in the public, right? And so it's nice to have people come to these kind of sessions and be able to interact with them on a human level. The reason we're doing that is to try to get more people involved, because elected officials are tired of seeing people like me at the ledge. They see people like me there all the time. But if we can get just 5% more regular folks engaged in the system, then you vastly increase the chances of moving the needle in meaningful ways and coming up with more creative and sustainable solutions. And if anyone wants to ask for specific ideas, I'm Josh at holamuacollective.org. So you can always reach out to me, and I'm always happy to talk and talk story and brainstorm ways to get involved.
You know, I'm wondering, when it's an issue this large, and when there are so many components, and as you went through the list of different things and approaches that you're trying to take, I'm wondering how you measure that success, because success might not be measured for a generation from now, and yet how do you know what paths to take and how to adapt, and what other demographics? Is it another survey? Is it other counts? Like, how do you, I guess, in moving this forward with such a daunting task, how are you trying to track out how you're measuring the success of this?
Yeah, it is a daunting task. You're absolutely right about that. There are a number of different ways that we can do that. One is on the part of our work where we're actually advocating for public policies. You can always try to see what actually passes, right? And a little bit wonky, but we have a 501c3 Holamua Collective that does most of our convening work and our data work. And we have a 501c4 Holamua Collaborative that does most of our lobbying work. Right. And so with the collaborative last year, we had a policy package of about 8 policy priority bills, and about half of those passed into law in some form or fashion. So we can always use metrics like that, which are good, but it's also a little bit beyond your control. So even more than that, some of the things that we look at are how many people are we able to bring to the table? Right. And so for these convenings that we've been doing, we've had over 160 people participate in them over the last couple of years. We've done them all in person. We're getting people to meet in person, which I think, especially in an age of Zoom and social media, where you can turn off your camera if you get upset, or you can slam someone from behind the comfort of your keyboard, it's important to get in person and talk to people face to face and realize each other's humanity. And see where you can find common ground. And that's another metric, is how often we can do that. And the number of times we've just had people come up to us and say, after one of these convenings, for example, you know, I used to think that person was a jerk, and I still don't agree with them on everything, but at least now I know where they're coming from. And that's hard to put on a spreadsheet, but it's the kind of thing that's going to make the meaningful difference years and generations to come.
We are almost out of time, but I do want to ask you, Ryan alluded to just how daunting this problem really is.
Yeah.
Bottom line, can we turn this around?
If I didn't think we could, I wouldn't still be doing it. And what I'd say is I totally agree, again, that these kind of things are daunting. 2 notes of why every single person can make a difference. As trite as that sounds, it's true. We're coming off an election season where one of our legislative races was decided by 11 votes in the final tally. So if you take a look at that, that's a clear difference. And last note, the thing that got me involved in polity and politics in the first place was a campaign I worked on when I was in high school to pass a tax levy to fund our high school that had failed for 10 years in a row. And I was a precocious high school kid who decided to start a campaign to pass the tax levy. And we got all the students involved, and we finally passed it by 40 votes, 40 votes out of the entire town. And it's those kind of stories that remind me, one person doesn't try that change, it doesn't pass, it makes a difference to the whole community.
Josh Wish from Holamua Collective, thank you so much for being here, sharing that data with you. We'll catch up with you during the session and see how it's going.
Thanks a lot.
And thank you for watching. Stick with us. We'll be right back.
Spotlight Now with Yunji Denise and Ryan Kalei-Suji. Connecting you with newsmakers from throughout our islands. Going in depth with Hawaii's leaders and taking your questions live. Spotlight Now, where Hawaii comes to talk.
One other interesting conversation. We began, of course, the show talking about some of the efforts and progress that's being made on the homeless front, specifically in the urban core of Honolulu, with this new facility that, as we got an update from, is really servicing the needs of the community.
Yeah, just incredible to hear some of the cases that they are serving, people who have chronic illnesses like cancer, diabetes, people who need to be on dialysis, just giving that critical care, and also talking about the changing demographic when it comes to who is homeless and who needs the most care. And we really are hearing that policymakers want to focus on those who are elderly. Those are the folks who need the most care right now. And you know, frankly, I think this is a conversation that's going to be going for some time. Interesting to hear that they're looking at new facilities to mimic this one.
Yeah, and that just goes to speak of the success that it's already having, really having this respite space that can provide some of the medical care. And you heard from Dr. Miskovich talking about how his conversations are going with some of the hospitals out there who have, and we've all seen it, right? Just seeing some of these homeless patients that are being released with bandages, in wheelchairs, knowing that they're not capable of taking care of themselves and they end up right back in there. He's saying, bring them to us. We can provide that care. Something that we haven't really heard of a facility being able to do that. And so progress hopefully is being made, but by all accounts, it sounds like they are very pleased with what's happening thus far.
Yeah, and then we caught up with Josh Wish from Holomua Collective, a very interesting nonprofit organization that is doing some creative policy work and had some really stunning data about the vulnerable folks in Hawaii, people who are working hard, who are making even six figures, who could be leaving Hawaii just because of the affordability issue.
Yeah, just really alarming when you hear some of those numbers. And we invite you to go and take a look at the results of that survey, because there are some startling numbers and even comments on there about what people are feeling and really feeling the squeeze and what will happen to our community if this continues to happen. So a great conversation. Again, we encourage you, if you've missed any portion of this, to head on over to the Spotlight Now section of HawaiiNewsNow.com so that you can stay updated with all that's happening here on our shows.
And we'll see you right back here next week for another episode of Spotlight Now. Thanks so much for watching, as always.